The quality of healthcare in Europe is often the envy of the world, but it faces challenges on several fronts. Financial challenges as budgets come under pressure, technological challenges as demand for healthcare continues to grow, and demographic challenges as our societies change and people's lifestyles change. Hello, I'm Stephen Jones and welcome to People First, the EPP Group's monthly programme that tackles issues that directly affect Europe's citizens and gets input from you. This month we're looking at healthcare. Among the issues, patient mobility, making it easier to travel to another EU member state for medical treatment. And degenerative diseases like Alzheimer's. As Europe's population ages, is the EU prepared? Well, joining us to discuss some of these important issues is Dr. Peter Liese, an MEP from Germany and our group's spokesman on health issues. He's also a former hospital paediatrician, so he's one of the Parliament's foremost experts on healthcare. Dr. Liese, thanks for joining us. Welcome to the programme. Let's start straight away with our first question.
Hi, my name's Mark. I'm from the UK. My question is, what is the European Union doing to help me get health treatment in other European countries?
Well, just last month, the European Parliament voted in favour of a package of measures to enable citizens to travel from their own EU member state to another member state for medical treatment. Let's take a look.
The breakthrough on patient mobility first came when the European Court of Justice ruled in favour of a British woman who travelled to France for treatment. Judges ruled that because she faced a long wait for an operation in the UK, she was entitled to be reimbursed by her local health authority. That was years ago, and MEPs and member states have long been trying to reach agreement on the extent and application of this right. Françoise Grossetête is the Parliament's rapporteur on this legislation approved this year.
Unfortunately, it was the Court of Justice that was making the law, so the time came when the Parliament, as a legislative body, had to seize the opportunity, and that's what we have accomplished today.
This new legislation gives patients a right to claim reimbursement for different kinds of treatments carried out abroad. National contact points will also be established in each member state to help patients and inform them of their rights. But although this legislation creates new rights, it is also designed to prevent medical tourism.
With the requirement for an agreement in order for a patient to be reimbursed, with the requirement for a member state to give prior authorization for hospital treatment abroad, with the safeguard clause that allows member states to control the planning and management of their healthcare and infrastructure, all this acts as a guarantee against medical tourism.
Beyond guaranteeing patients' rights, the legislation is aimed at forcing countries to improve their health care so citizens don't need to travel abroad in the first place.
Well, Dr. Liese, national budgets are under strain. Demand for healthcare is ever increasing. Is this a good thing? Is it going to work?
I think it's a very good thing. In the Parliament, our main concern was how to help the patients. For example, patients that are on waiting list for a treatment that is normally reimbursed in their country, but there's just not the capacity. They can go abroad now, or if you have a rare disease or a special treatment is necessary, which you can't get in your own member state, there is a possibility to go for a doctor or a hospital in another member state, and I think this will help a lot for a specific group of patients.
Some member states were worried that this would cost too much money at a time of national austerity. Is that your concern?
I think when you are on a waiting list, for example, for a hip replacement, you can't work, you suffer a lot, but also you can't contribute to the society, you can't go to your job. And that's why this medical treatment will not only create costs, but it will also give benefit for the society and for the economy.
Let's move on now to our second question.
Hello, my name is Marion Häublein. I'm from Nuremberg in Germany, and my question is, what's the UE doing against Alzheimer's diseases?
It's devastating to someone suffering from it, to learn that you're slowly losing your mental capacity to an invisible foe. To your family, it can be heartbreaking and costly.
We now have 10 million people suffering from neurodegenerative diseases, and most of them are suffering from Alzheimer's, so it is an important issue for all the countries.
Elena Oana Antonescu drafted the report on the European Initiative on Alzheimer's disease and other dementias. The measure had nearly unanimous support in the European Parliament.
Europe is trying to put all the efforts of member states in common to try to tackle this issue. And I'm speaking about financial efforts, I'm speaking about research, about knowledge, sharing information.
It's a growing burden. Scientists anticipate that as Europe ages, the number of people suffering from neurodegenerative diseases could double every 20 years.
We know that we don't have a cure for Alzheimer's yet. We have treatments for symptoms, but we don't have a cure, so that's why it's very important to early detect the disease, and it's very important to invest more in the research.
And the initiative goes beyond treating the victims.
It's very expensive for a family to take care of a person, a family that is suffering from dementia, and these aspects are treated differently in different countries. So of course that we also looked into this.
Are you concerned that we're not taking this issue seriously enough, given the impact that Alzheimer's has, not just on the people who suffer from it, but also their families and carers?
I don't think all member states, all responsible persons in the member states take it seriously enough, because we are all getting older, that's good, but that is also connected with a dramatic increase of Alzheimer's, and that will cause changes in society. We need to support the families that have to take care of these patients.
Now let's move on to a couple more questions.
Hi, I'm Laura. I'm from the United States, but I'm living and working in Strasbourg. I'm interested to know what the EU is doing to promote organ transplantation.
Mon nom est Ami Laraki, je viens aussi de Belgique, de la région liégeoise. Ma question concernant la santé, j'aurais souhaité savoir s'il y a des mesures européennes concrètes concernant l'obésité croissante concernant les enfants.
Okay, so let's take that second question first, about whether the EU has concrete measures in place to tackle the problem of child obesity. Now, you as a former paediatrician, you may have seen differences from 20 years ago when you were practicing medicine to now that you're a politician.
Yes, I see a big difference. I think important is better information on food, for example, on the energy content of food. We are in favor of labeling the energy content on the front page of every food, and we are fighting with the Council on this. But even more important is promoting physical activity.
Now, going back to the third question we saw about organ transplantation, you've really taken the lead in the Parliament on this particular issue in the Environment and Public Health Committee. Where are we now with this situation in Europe?
Yeah, we have adopted a directive, and that is an important step, that we have the same quality and safety standards all over Europe. Because until now, sometimes organs can't be transplanted because in that particular member state we don't have a compatible recipient, and the organs is just thrown away. When we have the same quality and safety standards, we can exchange organs all over Europe.
Okay, let's move on to our final question, which is a little more light-hearted.
Je m'appelle Jean Legros, je viens de Belgique, de la province de Liège. J'aurais voulu savoir s'il est vrai que 2 verres de vin rouge de Bordeaux par jour allongeaient la vie. Voilà.
Well, it does have a serious aspect to it, given the problem of alcohol abuse in the EU. Is 2 glasses of wine a day too much? Where do we draw the line on this? Because wine is part of our cultural heritage as well.
When you drink a very limited amount of alcohol, it doesn't harm the overall health, but it could even help to live longer. But this depends on the person, and unfortunately we don't have gender equality here. So in average you can say for a woman it's only 1 glass a day, and the second is already very harmful when you do it every day. For a man, 2 glasses, 2 small glasses may be okay, and the harmful effects are only starting to be overriding at the 3rd or 4th glass of wine.
Well, Dr. Liese, thank you very much indeed for joining us this month.
It was a pleasure.
Well, as we've seen, the EU faces a number of challenges on the healthcare front, but these issues are common to all 27 member states and demand a coordinated response. Well, that's all from People First for this month. For more information about our group's activities, please visit our website, eppgroup.eu. I'm Stephen Jones. Thanks for watching and see you again soon.